We're here at Busch Gardens, Tampa on the Gulf Coast of Florida with Dr. Pete. Tell us what it's like to be the senior vet at such a big facility.
Well, here at Busch Gardens, we've got a lot of different species that we work on.
Everything from elephants, zebras, and giraffes to hippos, gorillas, lions, and many, many more.
We've got over 250 species that just call Busch Gardens home. And then additionally, we also work with wildlife rehabbers working with native wildlife as well.
And you do a lot of actual rehab work from different organizations that find animals and bring them here and you recuperate them, correct?
Exactly, yeah. They'll find them, realize they need some form of medical care, and they'll bring them into us for that process. We'll do the surgery if they need it, fix them up and get them back out into the wild.
One of their most recent cases was an adolescent bald eagle who was found in a garbage dump with a broken wing.
The bone he broke was the humerus. It's this upper wing bone right here. We placed 3 small surgical pins, one larger one that goes down the middle of his bone, and then 2 small pins on either end in those fractures. That bar will take the pressure of the broken bone off his wing while it heals. That process will take 6-7 weeks, and at that time we'll take all those pins back out. And this guy should be, in theory, at that point, fully healed and ready to start flying again.
So I noticed during the checkup of the eagle, you used some lasers. What's that all about?
So what we were using there was actually called a cold laser therapy unit. It actually produces a wavelength of light that increases blood flow to the area that you're aiming it at. And the theory there is that it increases the healing time and also provides a little bit of pain relief. So for an animal like this that's coming out of orthopedic surgery, we'll do that for both those purposes.
After another 5 weeks, the young eagle will head to a rehab facility for therapy and eventually be released back into the wild.
Our goal is always to get our wild birds back out to the wild if we can.
Bethany introduces us to Edgar Owl Poe, an eastern screech owl who was found on the side of the road 6 years ago with a badly broken wing.
The fracture was of the humerus, which is the upper bone in his wing, just like what we have in our arm, right above the elbow. Our doctor, Peter Black, was able to do surgery to repair that wing. We were able to save the wing. And we all watched that day here in the Animal Care Center. Our guests got to actually watch the surgery as it was happening.
The bone eventually healed completely, but unfortunately, there was irreversible damage to the joint.
By law, he was declared unreleasable. Since he can't fly, he can't hunt, he wouldn't be able to feed himself in the wild. He's one of the few patients that we've ever treated in our hospital who actually ended up being placed back here at Busch Gardens.
Bethany tells us her typical day of assisting in the care of all the animals in the park.
Every day starts with checking on the animals. We're going to, of course, do the husbandry, which is the cleaning and the tending to them, making sure they've got clean water, and if they've eaten in the morning, they get their breakfast first thing. Some of our animals are going to eat later in the day.
At the end of each day, the staff provides the animals with an activity for the evening.
Each night before we go home, we're setting up enrichment and things for the animals to do over the course of the night. Enrichment in the zoo are anything that we do for our animals that encourages them to practice their natural behaviors.
These include activities, puzzle feeders, toys, or even a simple center spice applied to something in their habitat, all of which promotes their natural behaviors.
Our habitats here at Busch Gardens are amazing. We tailor every inch of that habitat exactly to our animals' behaviors and to their needs.
Habitats are designed to be comfortable, encourage an animal's natural behaviors, and allow for guest viewing.
Here in the Animal Care Center, we have the opportunity to share with our guests what enrichment means.
The kitchen area is open to the public, so guests can see how staff create the enrichment devices.
We can make puzzle feeders for our parrots, use paper mache to create objects for the animals to interact with. When our guests are visiting Busch Gardens or any of our sister parks, they're doing more than just coming to see the animals and ride roller coasters.
Busch Gardens Tampa not only helps animals local to Florida, but also worldwide.
Through the SeaWorld and Busch Gardens Conservation Fund, we support conservation projects, wildlife rehabilitation, habitat restoration, and education programs that helps protect wildlife worldwide in over 70 different countries around the globe.
Like Dr. Pete Black, each day is a new adventure for Bethany.
Every day is fun, helping our guests make the connection between how Them just being here actually helps us help wildlife. What I love about my role here at the Animal Care Center is every day I get to share with our guests all the amazing things that our doctors do for our animals, that our animal care specialists are doing for their animals.
Every year, the Busch Gardens Hospital treats close to 400 wildlife patients.
There are obviously a lot of different animals here. I know there's breeding programs and things like that. Where do the majority of the animals come from if they're not born here?
Most of the animals that are not born here come from other zoos. There's a very cooperative program with endangered species to basically share bloodlines across the country and even internationally.
All of the animals require routine physicals, which include an exam, x-rays, ultrasound, and blood samples.
This lets us find out how healthy they are on the inside as well as on the outside. A lot of wild animals don't want to show signs of illness because if you're looking sick, you're going to be the first one that's singled out by predators. So you want to hide those signs of illness.
Certain species require more frequent visits to set a baseline for care, especially as they get older.
And what I find really interesting is that these animals obviously always have to have different current exams and things like that, physicals. For instance, we brought in a kangaroo, we saw that today. What did you do with that kangaroo? And it's just a routine physical?
With a lot of our animals that live here at Busch Gardens, what we'll do a lot of times is routine exams to check them out. We'll do x-rays, ultrasound, draw blood sample, basically give them a full head to toe exam and find out how healthy they really are.
We got to see firsthand how these specialists handle some of their larger animals. The staff performed a routine exam on a 90-pound kangaroo named Boomer. While the animal is asleep, they use the opportunity to trim calluses that would normally be ground away in the wild and also get a blood specimen.
And how difficult is it to go from working on an eagle to a kangaroo to a hippo to a rhino?
You know, it does take a little bit extra, training to be able to sort of roll with that those changes in species, but we're pretty used to it. You know, we could be working on a lizard 1 second and then go get called away to go look on a zebra the next minute, and that's just all part of the job for us.
About half of all the animals at Busch Gardens are seen in the field, rather than bringing them to an indoor examination room.
We do a lot of house calls, actually. About probably half and half, which animals would come to the hospital versus which we'll go see. So everything you see in here that we use in our hospital, we have portable versions of. We've got x-ray that we can do in the field. We've got ultrasound we can do in the field. So that way we don't have to try to bring, a very large animal up here.
Routine procedures can be more difficult due to the size of some species.
For example, we had to do a tusk trim on one of our hippos. Relatively minor procedure, but when you're talking about an animal that size,
not very routine.
Not routine at all. It takes a big production.
This requires using sedatives along with specialized equipment just to open the hippo's mouth.
And I'm also interested in the levels of anesthesia because, you go from treating a small little animal to a big one. I mean, does that just come with experience?
A lot of it is experience. As you've done this kind of job for a while, you get used to working on different types of species. They all react a little bit differently. A gazelle is not the same as an eland, is not the same as a giraffe, is not the same as a bird.
Veterinarians from different facilities share their experiences and knowledge when they come across a situation they have not encountered before.
And it's a great community sort of exchange that way because no one's done it all and seen it all. So we got to be ready to talk to each other and share the knowledge that we have.
And I also wanted to ask about inclement weather. We're here on the Gulf Coast of Florida. What about hurricanes, things like that? How does such a big zoo like Busch Gardens, what do you do with all of those animals, especially from a veterinary standpoint?
Yeah, so you got to be prepared, of course, anytime in Florida that a hurricane could possibly come through, even if it's relatively unlikely. When we have one that's going to come close to us, we do have plans in place to move animals to safe locations. As veterinarians, we're basically on standby in case anything gets hurt. So we'll be on standby as part of the ride-out crew to wait out through a hurricane if that ever occurs.
Well, it's a very interesting career. Every day is different, like you said. Any parting words of advice for anyone watching, young people who might want to be pursuing a career in veterinary medicine?
You got to do well in school, of course. There's a lot of schooling that goes into being a veterinarian, and especially a zoo veterinarian. And then, just being motivated. It's not necessarily an easy career path, but it's a fun one. And if you just don't quit and don't give up on it, you can get there. It just takes a little bit of effort and a little bit of time.
Thanks to visitors around the world, SeaWorld and Busch Gardens have been able to rescue and rehabilitate over 28,000 animals. And their great work continues.
So thank you for having us, Dr. Pete.
Oh, you're very welcome.